All right, we're going to be doing a comprehensive normal pediatric physical assessment. First things first, I'm going to be assessing the pediatric patient's appearance. I'm looking at his facial expression. Looks pretty normal. I'm assessing his skin color at this time. Warm, pink, and dry. Nothing noted. Normal work of breathing, and no noted odors from his body or breath. Um, my patient has a normal activity level. He speaks when he is addressed. Um, he makes adequate eye contact and looks like he is in a normal mood. Chip, where are you right now?
The fire station.
Okay. Do you know what year it is?
2018.
Okay. And what are we doing right now?
Making a video.
All right, great. So his orientation is adequate. He's A&O times 4, able to follow commands correctly. So we'll assess his memory. What were you doing before we started doing this assessment?
Took somebody to get their car.
Okay, so adequate short-term memory. What were you doing last week?
Going to school.
Okay, great. So memory is intact and proper. We have already done a baseline set of vitals. His blood pressure was 118/84. His pulse rate was 86, normal, strong, adequate pulses, and his amplification was good. The patient's respiratory rate is 17. With adequate tidal volume, we were able to get an oral temperature. It was 98.3. SpO2 was 97% on room air. So we would assess his somatic growth, length. Obviously, for him, it would be height, but Chip is approximately 5'11", but with it. Weight, 180. And head circumference, he's got a big head. Skin is normal once again. Moisture. Hold on 1 second. We're making a video right now. Skin is moist. No excessive sweating. Nothing like that. Temperature once again is warm to the touch. The skin turgor. No turgor noted. It's adequate. No types of lesions or anything that I can tell. Nail conditions are clean. Everything is intact. We're looking at hair. Nothing noted on the patient's scalp. Hair is normal. Skull, everything is intact upon palpation. Face is normal. Assessing his eyes, we're looking. There is no visual acuity noted. Pupils are equal and reactive to light. And we'll assess extraocular movements. And he is able to follow my finger up, down, side to side. From here, we'll assess the patient's ears. No drainage noted. No extra wax. No deformity on the external ear. We're assessing his nose. No deformity. No drainage. No deviation of mucosal color. Mouth. The patient is able to open his mouth willingly. Has normal, adequate jaw tension, normal mucosal color, adequate moisture, and his upper airway, open up, upper airway is present. Neck, swallow for me. Okay, he has a midline trachea, no JVD noted. Chest, normal chest wall expansion, adequate movement. We'll assess his stomach. Oh, sure, it's tucked in. We assessed it earlier. All ribs are stable. No pain upon palpation in all 4 corners or quadrants. No open wounds. We would assess tracheal, bronchial sounds, bronchovesicular sounds, and vesicular sounds. Everything has been normal on this patient. His apical pulse is normal. On auscultation of his heart sounds, normal S1, S2 sounds were noted. The patient's arterial pulses are all intact. Radial pedal pulses are normal. Once again, back to the abdomen, no open or closed wounds noted. Size symmetry of the abdomen is normal. No scars, no distension on palpation. No decap BTLS noted on the patient. Back, get up, turn around. No open or closed wounds. Size, symmetry, shape, normal. No noted scoliosis, kyphosis, any deformities of the spine. No tenderness on palpation. All right, go ahead, turn around. Pelvis is intact. Any pain?
Mm-hmm.
No pain. Pelvis is 100% stable. Male genitalia, he told me that it's normal. Legs and feet, stand up again. All right, lift your right leg all the way up. Good. Put it down. Lift your left leg. Okay. Can you roll your ankle in a circle? Other one. Good range of motion noted in the patient's lower extremities. Pulses are intact. Skin color of the patient's legs are normal bilaterally. No open or closed wounds noted. We have femoral pulses. We have popliteal pulses, popliteal, and dorsalis pedis pulses are present. So we have bilateral brachial pulses and radial pulses. And that pretty much concludes my assessment of a normal pediatric patient. All right.